state of immunization information systems in Europe and the state of play and importance ahead of the European health data space. So my name is Bleddyn Rees and I'm the chair of the Digital Health Society. And it's my pleasure to be joined today by Professor Tudor Picciolak from Open Sky Data Systems, Professor Deepak Kalra, who is the president of the European Institute for Innovation Through Health Data, Zachary Deason from the policy manager from the European Health Management Association, and later we'll be joined by Mr. Sokal, the member of the European Parliament, who will join us for the panel session, and I will introduce him a little later on. I'd like to quickly acknowledge MSD support, as they have been instrumental in supporting both the roundtable work of the DHS and IHD, as well as the Open Sky work, and indeed the work from EMA. So a little bit about the aims of today. And as you can see from the screen, we aim to answer 3 questions in this webinar. So 1, where do we stand in Europe? 2, what needs to change and improve? 3, what's at stake and what are the benefits for health systems and for citizens? So a quick look at the outline for today. So as you can see, quick introduction, 2 presentations, and then we go into the panel discussion. 2 points to make. In the panel discussion, we'll address questions from the audience. So if you'd like to ask questions, please use the chat function, and we'll deal with all the questions in the one session in the panel. And also you'll see in the chat function links to both the Open Sky summary report and to the roundtable report that Deepak will be presenting on. So by way of background and some context to this webinar, Deepak and I and our organizations have collaborated during the last 3 years, creating the calls to action on health data ecosystems. This was very much about assisting and developing and informing rather the developments of the European health data space using multi-stakeholder roundtables of between 20 to 40 organizations and experts. To give you some illustrations of the work, there are 7 calls to action, which we can't talk about today, but again, in the chat, you'll see links to the actual calls to action report, as well as the deep dives from the subsequent roundtable, which we published reports. And just to give you a quick illustration of what those look like, on the screen, you can see some of the topics covered in roundtables 1 to 3, and then roundtables 4, 5, and 6. And again, in the chat, you'll see links to the published reports if you want to follow up and look at those. So without further ado, I'm going to hand over to Tudor to start the presentation about the Open Sky report. So Tudor, over to you.
Thank you, Bleddyn. Good morning, everyone. I will now share my screen. I hope you can see my screen now.
Yes, thank you.
Okay, thank you, Bleddyn. It's very good to have such a start for the new year with this event. It's the first of this kind that I'm attending, and I'm happy when I saw the list of the people that confirmed the participation, that we have, as I said, a very serious start of this year, which is very good. Well, I will discuss a bit today about the electronic vaccination registries in Europe, following initiative of MSD that started about 2 years ago, and Open Sky Data Systems has been involved since in a series of researches and surveys on this subject. I'm sure that you already have access to this to this report, to this summary report, the state of the art in electronic vaccination registries in the European Union and the United Kingdom. I will go back to this one, but first I think it's more relevant today to have an image of the overall approach. So I will discuss about the methodology a bit, the project goals, some funding, next steps, some conclusions. Of course, I will focus on details mainly on the first phase because we have this report already available for everyone. For the other ones, I will only mention them because I cannot give you too much details until the report will be approved by MSD. So the project goals, this is overall map the state of the art on electronic vaccination registries across EU and UK. But afterwards, you will see we went well before this geographical area, identify the best-in-class electronic vaccination registries in place. Of course, this would give will prove to be a very useful instrument offering this rapid and reliable information on vaccine coverage rates. And of course, spot the European divides. We know that those divides exist in terms of preparing and using the electronic vaccination registries, and of course, issue some recommendation for overcoming the cleavages. We discussed, I think, starting from March, April 2021 on preparing the first phase. The idea was to identify the current state of the art in EVRs in the EU and UK countries, emphasizing the HPV vaccination. Of course, afterwards, the idea was to select the countries that would score the most and to perform an in-depth analysis of registers in these countries. Afterwards, we decided that these two complementary approaches need to be, approach in two dedicated phases. So I will come back to phase one report, but regarding phase two, the idea was to use the findings and lessons learned to inform decision makers. And of course, we participated in several events like this one, together with Bledin and Deepak and other colleagues in Microsoft, G&G, MSD. And it is, we were able to see the fact that the interest of the people to be involved in this research increased. At the beginning of first phase, it was a need to change a bit the methodology to focus mainly on desk-based research because it was different. It was difficult to have people involved in interviews, but afterwards things changed. Which is a very good sign that we are dealing with a very relevant issue here. So again, in phase two, an in-depth analysis of HPV electronic vaccination registries have been performed in 6 countries. You will see afterwards why we selected this, having a look at the heat map. And of course, in order to do this, in the methodology for phase two, we understood that we need to generate a virtual model or gold standard of a desirable common or minimal or optimal architecture in order to integrate relevant features in various EVRs. You can have here a brief image of this virtual model. And you can see that we covered those 4 areas extremely important, from individuals to population to governmental, intergovernmental, and of course industry, research, academia, in order to have, you need to have in a virtual model, in a gold standard architecture, you need to have the needs of all relevant stakeholders captured. this was the idea, and that's why we have done this. And of course, afterwards we applied it. I won't enter in details. In the second part of the webinar, I think that our technical director William Flanagan maybe will join us, and maybe he will be it's in the position to answer more questions regarding the technical aspects of this approach. The third phase that was recently finalized, we added to the heat map and to the scorecard 3 more countries that are neither in the EU nor in the UK, meaning Norway, Switzerland, and Serbia. Very, very interesting results on this small part of the third phase, because the main part of the phase 3 is there were some technical approaches to improve the operation of EVRs in specific geographies. Because the idea, as I said from the beginning, when I was mentioning the goals, is to catalyze the development of the not so developed EVRs in various countries in Europe. Well, phase 4, which is in the making, because we all are aware COVID-19 was not a problem of the EU or the UK or in Europe. It's a problem for the entire world. Yeah, it's pandemic, and you cannot tackle it with a local, regional approach, even continental approach. It must be a global approach. That's why we need to enlarge our approach, and we will have the countries in Asia Pacific, enter in our scorecard and in the heat map. Okay, going back to phase 1. Of course, we would keep absolutely the same methodology for mapping any country. We do not say that this methodology is impeccable, but we need to keep it exactly as it was for the first use, because otherwise we won't be able to have, we cannot do some comparative approaches. So use some desk-based research, you use the list data capture sheet, we used a scoring algorithm, and of course we generated a scorecard and a heat map. Okay, we can see that it's important. Yeah, the existence and relevance of the EVRs are crucial for increasing the VCRs. There is a will in absolutely every country to increase the vaccination rate, which is extremely important. There are ICT solutions in place for vaccination registry. We learned that inertia plays sometimes a particular role in delaying the implementation of new ways of registering vaccination, because, and it's understandable to some point, because if you have a system that is working, you are not so keen to change it, just, but sometimes this is not the best approach when you want to make some systems interoperable. You need to enter in a dialogue. You need to give some things in order to receive others. Another key learning is that the opportunities offered by the European Union must be utilized, like European Health Data Space initiatives. And definitely there is a need for an EVR template in Europe, and this one, as the minimum common denominator, would allow interoperability, which is crucial. Okay, this is the heat map. You can see definitely this was striking from the start. When you created this, you can see the two divides. One is between the northern part of Europe and southern part of Europe, and another one from the Western countries and Eastern countries. And of course, this, as I said, this opened the way for the second stage. You can see we decided to focus on countries that scores at minimum 85%. But you can see that we have in this area all 4 countries in the UK. And of course, because they are not identical systems, but are quite similar systems, we decided to focus only on one, and it was Scotland. Okay, I'm approaching the end of my time, so a few conclusions. There are variations in using ICT for vaccination, as I said, in northern part of Europe, the southern part, western part, and eastern part. There is a certain correlation between the EVRs and the VCRs. We are not saying that there is a causation, but definitely it's a correlation. We have no intention to see if it's a causation, but definitely it's a correlation. And we're positive that a common approach to EVRs would make a difference. Of course, regarding the challenges toward an interoperability of the systems, you know, the variations between EVRs in use are substantial. The strongest EU countries are difficult to influence, and we're discussing here about the Germany, who has, being a federal country, they have very specific system. France, which has a unique system. They are very proud of the system, so it will be difficult to influence these countries, but it's not impossible. And of course, there are technical constraints. Opportunities, there are opportunities. The focus on the European Commission digitalization, the quantitative results in the past 15 years of vaccination, especially in HPV, and the practices catalyzed by the pandemic. As I said, we need to insert as many countries as possible in the analysis, because you will see in the next reports the extraordinary influence of the culture in each region on what is happening with the EVRs. Okay, so we know that the interest, and it's very important that the interest on the matter is consistent. The momentum for action is here. It is time for a qualitative leap. We have this relevant correlation between EVR and VCRs and interoperabilities that will, against the divides. We'll have the opportunity after Deepak's presentation to discuss. Thank you very much. If you have any questions afterwards or during this webinar, please do not hesitate to address it or to contact me. Thank you very much.
Tudor, thank you. So if you stop sharing, and then Deepak, if you just go straight on. For those of you who've seen the link in the chat to the Roundtable 5 report, inside that report, there is also a link directly to the Open Sky summary. So Deepak, over to you.
Splendid. Thank you very much indeed. I seem to just have to reach my button. Good. Well, thank you very much, Tudor, for really explaining everything that you learned by looking in detail at the different countries. What I'm going to now do is to summarize the findings we had from a multi-stakeholder pair of roundtables that we ran in order to better understand what do your findings mean for Europe in terms of immunization information systems. First of all, why did we feel this was such an urgent topic and so important for Europe right now? The first one is that we have learned that through the COVID-19 pandemic, how important it is for countries to be able to collect and share with each other at a European scale real-time and interoperable data. In particular, for example, the cooperation that took place to put into action the digital COVID certificate. Your report and your findings, as you've just summarized them, showed us that across Europe, there is still a lot of variation in the maturity of immunization information systems, but importantly, that where countries have invested in having mature information systems, this has an impact, it seems, on their vaccination coverage. At least the correlation is strong between the two. And then, as I'm sure everybody on this webinar knows, we are at an exciting point within Europe where we are looking forward to the European health data space, which is going to provide an accelerated mechanism for citizens to access their own information, and that can be about immunization information. And also it will provide channels to enable intelligence on topics to be shared, such as coverage, outbreaks, the effectiveness of the prevention strategies that countries put in place, and also the effectiveness of containment strategies that countries put in place. So there has never been a better time for us to take advantage of immunization information systems and European data superhighways. But at the same time, the learning from COVID is there has never been a more urgent time for us to be prepared for anything that might arise in the future. So what we did was to establish a pair of roundtables. We selected around 20 people who came from different backgrounds, including those who had expertise in vaccine development, immunization programs, public health clinicians, immunization information systems, and more broadly in health informatics, including standards. We held the roundtables in June and July last year, and our goal was to look at what might be the actions that could accelerate Europe's intelligence capability and the effectiveness of the programs. Tudor, you and your colleague, William, came and joined our roundtables, and you presented your findings there, and they informed our thinking. And what we focused on really was the use cases for immunization information systems. What might be the design considerations? Where do we need to leverage standards, and what are the other success factors? And we distilled recommendations and calls to action. And just in a few minutes, I'm going to summarize those things. Firstly, the use cases. And it was interesting that our group really felt that the success right across Europe of immunization information systems starts by making sure that individuals are empowered in the process, that they have access to their own vaccination records. And that isn't just what they've had, but what is planned, what is expected in the future, when is their next immunization scheduled, etc. That it's important that we can enable individuals who travel across borders to experience good continuity of care regarding their vaccination schedules. We should track the emergence of complications and adverse events at the level of individuals so that our vaccination programs start to become more and more personalized to individuals and also at populations, so that we can have the evidence to give confidence to the public about the safety of vaccinations. We know there was a lot of anxiety about complications and side effects from the COVID vaccination, which inhibited some people from taking it. If we had better data, we may be able to more strongly evidence the likelihood of people getting complications from the vaccination as opposed to complications from the disease. And then we need to do linkages between the coverage of vaccinations and diseases, so we can advise people that if they are not vaccinated, there are risks to them of certain diseases that are prevalent in their areas. We should be able to look quickly at outbreaks against vaccination coverage and see, have these outbreaks occurred because the coverage dropped? We should also be able to look more carefully at the effectiveness of campaigns. We need to use the data for both academic and industry research and to learn from each other about the vaccination programs and the delivery models that seem most successful at engaging the population and protecting the population. So when we looked at the totality of information systems, not necessarily one big bang information system, but maybe a portfolio of interconnected systems, we saw that it's really important that there are a number of functions. I won't read every bullet out. A number of functions that are targeting the individual, person-specific systems that deal with the immunizations people have had and what's planned, and also health issues. Screening test results could be very valuably integrated with these so that people know whether they have been protected, if that's the screening, or if they are at risk, if that's the screening. And that we should try and link this to the International Patient Summary, which gives a more holistic summary of people's health and risks. Then at the population level, running programs and schedules, a kind of customer relationship management system, and then population level intelligence around screening, and then those pieces of an immunization system that deal with the programs that are being developed, the vaccine supply chain, so that we know where the vaccines are available to deliver to patients and where there might be gaps, health education programs, outbreak tracking, and so on. So this really is the one-slide summary of what the ideal gold standard immunization capability should, intelligence capability should be. So we then had a series of recommendations, and I'm just going to go through those on a few slides. The first one, the number one recommendation, was that we should seek for the European Commission to place immunization as a focus within its One Health mission. That we feel that immunization must be a really critical part of the strategy for Europe. And the report, if you download it and read it, contains many prerequisites and success factors. I've only hinted at a few which are in the report, and they are all necessary to address if this one recommendation is to really thrive and deliver value for Europe. We have some other recommendations too. We felt that the European presidency is a very powerful vehicle, if you like, for promoting the importance of immunization. And we recommended that each time there is a change in European presidency, the new member state should pick up the baton of Europe-wide alignment on data sets and standards and immunization systems. We felt that there is still need to learn more and to consult with member states about what might be the ways in which we could promote countries that are in the amber or the red zones of Tudor's report. How can they change their game and be supported to become green? Is that funding support? Is that piloting support? Is it that they could benefit from expertise and mentoring between countries? Or maybe because the investments in ICT are very high, could we establish some centralized or shared technologies and tools? That doesn't mean the data has to be shared. It can still remain national, but the technologies might be shareable. Can we somehow support countries to all become green? We recognize that for many of the use cases that I've summarized, there are some data sets that we need to define and agree so that we can all collect and use the same data, share the same data. And this does need multi-stakeholder engagement. It requires cross-country engagement. And we felt the WHO to be a very powerful player in helping to promote this. Interoperability standards are vital. There are many, but we will need further deeper dive immunization specific ones. We need data quality standards to go with it if we're going to use the data to make really important decisions. Then we need to coordinate not only within health, but cross-sectorally, because we recognize that immunization records and immunizations themselves are administered by a number of services, not only health, and school and occupation are two examples where that arises, and we need to collaborate within and between sectors and across Europe. Then we felt it's really important that the European Commission must advance coherence on the immunization systems and support the early adoption of an immunization data space within the European health data space. I think we all felt that the EHDS is such a powerful opportunity that we should encourage the Commission to make immunization an early adoption case of the EHDS. And in partnership with that, we felt that there must be some large-scale demonstrators of how a coherent immunization information ecosystem can deliver value to individuals, to countries, public health, and so on. And we felt we would find that regional health systems could play an important role in helping with those demonstrators and the sharing of learning from them. We felt that there is a real need for multi-stakeholder engagement across all of these things, and we wanted to implore DG Health and DG Connect to work together across a number of these stakeholders. And here you have a list of those. There are some which are cross-country, like the EC, the ECDC, and so on. Then there are the ministries that have very powerful roles to play. Let's not forget patients and civil society. They are really important because in the end, we have to win the trust and confidence of society with any immunization programs. And of course, healthcare professional organizations are important too. We need the experts in clinical and immunization topics, standards developers, and semantic experts so that everything is interoperable, connectable, and co-interpretable. Now, we also had some success factors, and I've just put on one slide, perhaps the most important ones. And it was interesting that the most important success factor of all is public trust. And here for this roundtable, we were focusing on public trust in relation to immunization systems, GDPR compliance, but also transparency about how the data are being used. We know that when there was the possibility of tracking people, location tracking for COVID purposes, there was a lot of anxiety about who else might access and use individuals' locations for other purposes that they wouldn't be comfortable with. And we felt that actually trusting the information flows and the information systems is connected with trusting the vaccines themselves. They are separate topics, but somehow they do seem to cross-connect. It's really important that the scope and the use cases of immunization information systems should be agreed across stakeholders. And this is not just because we want to try to encourage the complete landscape that I've presented, but perhaps even we should be mindful that for countries that need to invest significantly to raise their status, for example, the red countries in Tudor's map, that we need to be careful that we should help them to prioritize where they should invest first and which use cases they should put into place as quickly as possible so that they can target what might be limited investments. The core data set, I've emphasized the importance of that, and so that you can imagine was a critical success factor. And then data sharing protocols. The success and value of immunization systems critically is that we work together and share together so that we can learn from each other, but also we can protect each other with early intelligence. And so we need protocols that cut across quickly and efficiently the rules, the committees, the approvals, so that when it needs to be done fast, it can be done fast because we've defined and agreed all of the data sharing rules, permissions, protocols in advance. And that will allow us to be rapidly responding to any threat in the future. So, Bledin, thanks very much. That's the key summary of our report. And I hope what I've done is given you a quick heads up, but perhaps also what I've done is left you with an appetite to download the report and read more.
Deepak, thank you very much indeed. And that takes us then to the panel discussion. So we're joined then by Zachary and by Tomislav Sokal, who I'd like to briefly introduce to you now. So he is the Croatian MEP, but I'm delighted to say that he's a lawyer by training. So rather like me, a force for good, I believe. That's what lawyers do. He's a senior lecturer at the Zagreb School of Economics and Management. But for the purposes of today, he's eminently qualified to join us as he's on the special committee on COVID-19, looking at lessons learned and recommendations for the future, as well as being the co-rapporteur for the European Health Data Space. So we're going to start the panel by inviting Mr. Sokal to give us some introductory comments. So over to you, thank you.
Okay, thank you very much. Thank you very much for inviting me. I think this is a very interesting and important topic now, as you mentioned, both within the context of the special COVID committee, where we are having a lot of discussions on vaccination, and of course, in the context of European health data space. When we speak of COVID-19, we know that vaccination has really been the major issue in the last more than a year, and one of the most important factors in containing the spread and the consequences of COVID-19. I have to say, even though I have to say, it is also true that the vaccination has been also one of the most controversial parts of the response to COVID-19. And I have to say also, unfortunately, that in the COVID committee, the European Parliament, we can hear a lot of populism and a lot of and I have to say even fake news, which is being spread in the European Parliament on this, and a lot of opportunities for some political groups and some colleagues to try to get and score political points on this issue by spreading and enhancing controversies and actually doing and making argumentation which is definitely not in favor of stronger public health protection in the European Union. So this is definitely this is a very controversial topic when you speak of vaccination on COVID-19, and we have to also realize this, that whenever we have some kind of political discussions within the European institutions, especially the Parliament, this is the discourse that we have to deal with, unfortunately. But of course, despite this fact, I think that in general vaccination has been a big success. But also we can see big major differences across the European Union. For instance, in my country, definitely the vaccination coverage is, I think, around 60% or something like that, which is definitely much smaller than, for instance, in the Netherlands, in Germany, etc. And this shows one of the major problems when we speak about European Health Union and having this kind of a concept actually working, is that we have enormous differences across different member states in terms of culture, in terms of organization of health systems, in terms of public perception. But also in terms of gathering data and making data be able to be so that interoperable, so that we can compare the situation in different member states. All of these are major issues that we have to deal with today. When we speak in general, of course, this is also kind of this is also one way that we can that is possible to be used, so that we actually connect this with the other topic, which I think is even more important. That's the European health data space, because we saw in the COVID-19 pandemic that, especially in the beginning, there was many problems in terms of sharing data, in terms of getting interoperable data, and in terms of actually comparing situation in different member states. And this is definitely a big problem, because then it's very hard also to make policy decisions. And I think one of the major advantages and major benefits of the European health data space, if we are able to make it work, will be actually to be able to have enough data that we can compare situation in different member states and actually make policy decisions based on that. So when we speak of European health data space, this is I think the most important public health initiative that we will have from the European Union in this mandate. The most important piece of legislation. I think that's the only major piece of legislation that we are able to adopt in this mandate before the European elections, because with the pharma legislation, we're still waiting for the proposal of the Commission, and I think it's too late now, already now, that we have this adopted by the end of the mandate. So definitely the main focus of the European Health Union and European Union legislators in the area of healthcare will be on health data space. So when we speak of health data space, the whole idea is that we can make that data can be used across borders for two purposes. So first is the primary use of data. So this means, for instance, that if you are traveling to another member state for work, for business, if you are a student who is on student exchange through Erasmus or something else, and you need to see a doctor, you need to have a health treatment or diagnostics or something, that the medical professional in that member state can access your data your European electronic health record from other member states, so that they have access to this data, that they don't have to repeat certain diagnostics, certain treatments, so that they know, for instance, if you have any problems of allergies, which is important when they choose whether to conduct a certain treatment or something like that. So this is the idea. So this is the primary use of data, so that your data, of course, based on your acceptance, based on your consent, can be used by healthcare professionals in different parts of the European Union, so that we can facilitate free movement of people, so that people can move across borders much more easily, and knowing that they will be able to get healthcare much faster than it was up until now. The second important part, however, which will be probably the most controversial one, is about the secondary use of data. And secondary use of data means, for instance, use of data for policy reasons, use of data for research, using real-world data as well, which is very important, for instance, for new medical technologies for rare diseases, where you don't have enough patients to conduct phase 3 clinical trials. So all of this, so the data can be used for all of these purposes across the European Union. And of course, here, what will be at stake and what will be the major issue is what will be the patient's role in this process, how we will be able to protect patient privacy, how we will be able to deal with intellectual property rights and things like that. And this here, as I said, this is the most controversial topic. We will have the biggest discussions in the European Parliament on this, because I know that different political groups will have different agendas on this. My position is, and this is my overall position in general about European health data space, is that I don't want to unravel the Commission's proposal that we have. I want to improve it, but I want to preserve the main principles that we have. And the main principles are that we need to have this data used, that we need interoperability, that we want to make it easier and actually facilitate the use of data in different member states that we cannot use now. Of course, there will be a lot of legal issues to be resolved. As you said, I'm a lawyer. For instance, how to align the EHDS with the GDPR, how to align the EHDS with different sets of legal rules which are being adopted now on the European level, the Data Act, AI Act, and all of these other things. But I think that we have really a possibility to make this work and make it easier to use data across Europe. Of course, what this means for immunization, of course, immunization, vaccination data can also be part of this. This is very important. Whether we can go further and have some special sets of rules on immunization and vaccination at this stage, that's questionable whether we can do this, because we will have to work a lot to actually get the political agreement on this, on the overall health data space. But of course, once we have the EHDS regulation in force, and I hope that this will be in 2024, then we can think of how different types of data for different purposes can be aligned and can be part and fit within this common European system. Of course, just one thing that I also wanted, and then I will finish. What is important is when we speak of vaccination, there are different ways how this data can be used, but we have to be really careful and not to expect that we can use this data, for instance, to limit free movement across borders. So for instance, for instance, that if somebody is not vaccinated for a certain disease, these people that we prescribe that this person cannot travel between different member states, etc. So this is something that we do not have currently legal possibility to do. So this is not something that European Union can regulate in this sense, because EU can, by way of legislation, facilitate free movement across borders, but we cannot impose additional restrictions. And when we adopted European digital COVID certificate, the purpose of this was not to limit movement across borders, but actually to make it easy. And this was the only reason why this legislation could have been adopted on EU level. But so we have to really be careful on this. And if we use this vaccination data, immunization data across the European Union, we really have to be very careful on the purposes how this can be used, because I believe that limiting free movement for individuals is something that will be very hard to do, and this is something that will be, I think, contrary to the whole purpose and whole idea of European Health Union and what European Union is doing for that. Having interoperability, yes. Having standardized protocols and possibilities to share data, yes. To use this data in an aggregated way to make policy decisions, to make recommendations, to prepare public policy responses, yes, but not to use this data to limit individuals' right to free movement between different member states. I think this is something that is my position, but I think this is something that will be also the position of the European Parliament in general. So thank you very much, and I look forward to the discussion.
Thank you very much indeed. So that moves us then to starting the panel discussion. And so the first question I'm going to ask is to Zachary. So can you tell us a little bit about the work that EMA is now doing as the third part of the reports into this subject?
Yeah, sure I can. And thanks, Bladen, for having me and giving me the chance to share the work of the European Health Management Association on this platform. So we're actually working on several projects that are relevant to the topic. We have a project, a European-wide project promoting mutual learning and sharing best practices between member states to overcome administrative, financial, and technical barriers to vaccination. We've also recently published a white paper outlining recommendations for digitalization of medication management pathways in European hospitals, which of course will extend to the digital management of vaccine storage and supply chains. We're also leading the multi-stakeholder Be Well project, which is taking a coordinated approach to modernize the health workforce through the development of green and digital skills, which of course will be essential for the successful implementation of all digital health initiatives and interoperable data systems for vaccination. And of course, most relevant, we're launching a position paper at our own webinar, which will take place on 26 January. And that's going to present policy recommendations that we've developed alongside health managers in our member states to address their practical needs related to digital transformation within the European vaccine ecosystem. So these recommendations build on today's discussion and align well with the work of IHD, Digital Health Society, and Open Sky, because we all have the shared goal of better informing the ongoing development of the European health data space.
Great. And are you able to share any insights that you've already had from member states so far?
Yeah, a key finding actually from our work with the member states, particularly from speaking with health authorities that are engaged in vaccine program delivery, is that they have a clear need for enhanced data in order to do the work in an evidence-based way. So many of the health managers we've spoken with about the topic express that they do have access to interconnected health databases to some extent, that offer them access to shared data either between a regional or different hospital network levels. However, they also express a lot of frustration that some of these databases haven't been designed with their practical operational needs in mind. So health managers in member states, they would benefit from a European data space that gives them the ability to stratify and sort data sets based on the needs of vulnerable population groups and hard to reach demographics. And ideally, this data system would allow them to observe which vaccines and vaccination programs are being employed for these groups in other member states as well. So essentially allowing for the continued development of mutual learning and knowledge sharing at the European level. And ultimately, as Deepak mentioned in his presentation as well, co-creating a data space that meets the needs of health managers and other stakeholders that are working with vaccination will also help us to meet the vaccination needs of citizens in the end, which will be the goal.
Great, thank you. So the next question then for me is, immunization information systems are all about data, so that data science, analytics, and tools are essential. How do we need to encourage the development of these workforce skills to realize the benefits of this data? So if I ask sort of Deepak to start, and then we'll go across all of the panel.
Well, thank you very much. I think that the value we really have to focus on is what when we put in place and invest in these immunization information systems, what are the benefits? And I think on the one level, we really should show that the benefits do deliver back to the public, because they become better safeguarded through better vaccination coverage, but also they are better safeguarded because the data is used to plan how best to protect them. And I'll use the word protect for that umbrella of public health strategies, ministerial strategies, and so on. We have to make it clear that these are not toys. We're not asking for the public to endorse investments in immunization systems, nor are we asking them to endorse data sharing for other purposes that they might not support. We've got to really focus on the benefits back to people. And yes, the public have to be brought on board, but decision makers themselves are really influenced by public opinion. And so it's really important we do that. Now, Tomislav, you mentioned, of course, that once we enter the world of secondary use of data, we start to hit anxieties about GDPR, anxieties about whether people should share, whether the public support. And again, I think without emphasizing the benefits and why we want to do it, we will fail. We have to prioritize that. And we also need to find examples where doing that has already delivered value, so we can point the public and say, would you not like your country, your city, to be protected and safeguarded and running well in the way that this place is doing?
Thanks. Zachary, what about, I know that Be Well touches on aspects of this about skills.
Yeah, indeed. So from our perspective, I think when it comes to giving the workforce and bringing them on board with the health data space and more digitalization, it really starts with developing the intelligence on the existing landscape of what digital skills exist within the health workforce right now across different member states, and what gaps are there. Because once we have a picture of the existing gaps, we can bring together all of the relevant stakeholders, so healthcare workforce, policymakers, labor associations, patients, and we can co-create solutions with education and training providers together. Because essentially having all of the relevant stakeholders together at the table with a clear picture of what's needed is basically going to be essential for helping us build up our health workforce with the strong foundation of digital skills.
Thanks. Tudor, I'm expecting that some of your work is you'll have come across the need for data scientists and the skills. Do you have any observations about this subject?
Yes, definitely. It is very relevant, this issue, in order to make use of the data that we are creating. I was a bit surprised to see that in the national recovery and resilience plans, there are not very specific put, the need for those skills in the area of vaccination. Maybe, of course, there are skills that could be used across many sectors, but there are countries like in Ireland, for instance, the Irish National Recovery and Resilience Plans indicate that a specific amount, a relevant amount of money will go toward improving, the skills of the workforce in general in digitalization. But I'm expecting that, during the fine tuning of this programs until the end of 2026, maybe some more focus would be clear toward this electronic development of electronic vaccination registries and in general, the e-health data space in each country. This is not present at the moment, but I'm sure that this could be changed during the following years.
Thank you. Mr. Sokal, anything from a policy perspective for you?
Yes, several issues. First, I want to say I agree with all the previous speakers. I would just like to add some things. So first, I think we have to really look at individual health systems, individual member states, because there are enormous differences in terms of digital literacy, in terms of openness to new technologies, in terms of the infrastructure which exists, which in some member states is major issues. Also, the organization of the system itself. So how much you can influence it from the policy point of view or not. For instance, in my country, primary care providers are mostly private providers contracted by the health insurance fund. And because of this, we saw that actually in terms of public health duties that they have to face, there were major issues because of this. They actually have to say they in many cases were complaining that they are too overburdened, they have too much administration, not enough support, etc. While in other member states where these people are employed by the public system, it's a different story, and the whole dynamic between the policymakers, Ministry of Health, and the providers is different. So really, so to look at individual systems, individual culture, and the way of organization of individual healthcare systems in different member states is crucial, especially since healthcare is primarily a national competence. So this is not something where we can go top down in terms of imposing legislative obligations upon the member states, but we really have to talk with them and to discuss with them and to try to get them on board voluntarily. So we cannot force them to adopt something. Also on the national recovery and resilience plans, yes, I think this was a major opportunity to actually do something, because here, unlike in other issues, we have actually the financial leverage that we can use for member states to actually conduct investments in healthcare, which in general is not the case, because I said in general, member states are free to decide how to organize their systems in whatever way they want. Of course, there were some problems with it. So first, the way how it was adopted. So the whole recovery and resilience plan was more or less politically decided by the member states. Parliament and Commission were involved, but in the end, it was a political agreement between the member states. There wasn't a lot of time, so there was a big time pressure to adopt these national plans. There was a lot of problems in terms of administrative capacity on part of the Commission to actually go in depth into the national recovery and resilience plans. So what we got in the end was that each member state more or less defined their priorities on their own. It wasn't really kind of apart from these overall principles that it has to be some percentage about digitalization, about green issues, etc. But apart from these overall principles, more or less, member states had the full autonomy to define on their national level what they want to do. And I don't have the overview of the all national plans, but those plans of Croatia and neighboring countries, which I observed, seems to be focused more on, when you speak of digitalization, on health infrastructure. There is part about skills, etc. But when you speak about workforce in general, I think the focus there is to actually create better working environment, higher salaries, better equipment, etc., so that we prevent people from leaving to other member states, so that we prevent this outflow, this emigration, this brain drain that we have in Eastern Europe, but not a lot of focus on actually investing into skills, especially digital skills. And I think this is a major issue, especially if I can say, in older generation or more experienced generation of health workforce, where there is a much stronger opposition to adoption of new technologies. But again, this is also individual, so it's not the same in all member states. So I think that I'm afraid, I hope it won't be the case, but in terms of investing into digital skills and creating some common European framework, I'm afraid there is a big chance that there will be a missed opportunity on the European level. And I hope it won't be the case, but from what I am hearing and seeing today, I don't see that we will be able to get much improvement on this issue. So I think in the end, in 2026, we'll have a lot of new technologies. We'll have hopefully European health data space, but in terms of the digital skills, this will remain a major issue.
Okay, thank you. I'm just going to pick up a couple of questions coming in from the audience as well. So the first one, and I'm happy for anyone to jump in here, is there an intention for the EU or WHO, or perhaps do we think there should be, to maintain the PKI infrastructure that allowed electronic vaccination certificates, QR code validation for international travel beyond COVID?
If I may, I think I already partly answered this. So this is something very controversial. Sure, yeah. And there was a lot of opposition, a lot of political groups trying to get advantage and by spreading fake news out of this. So probably some the infrastructure could be maintained, but to use it in terms of, as I said, to limit, for instance, free movement, access to certain public services, etc. This is something that will politically be a no-go area for me, I think at least. But one of the main problems that we have here is that we weren't able to communicate really who does what with EU digital COVID certificate. Why? Because so we adopted COVID certificate to facilitate free movement, to make it easier, so that people who before that were not able to travel or who needed to get tested every time before traveling. For instance, for myself, 6 months for 6 months during 2020 and 2019, I needed to get tested every week if I wanted to travel to Brussels to the European Parliament. And the whole idea of EU certificate was to make it easy, so that people, if they are vaccinated, if they survive the disease before, then they don't have to go through all of this. But what happened in the end, that this was perceived in many member states, like in by many people, as imposing additional restrictions. Why? Because member states use this certificate to limit free movement and to limit possibilities to access some services within member states. But this is something which EU has nothing to do with. So EU adopted this EU certificate so that you can travel across borders more easily, that you have more possibilities. But member states use this infrastructure then to say, yeah, but within our territory, if you want to access public health institutions, hospitals, for instance, or something like that, you need to have this certificate. But this has nothing to do with the EU. So what happens within the national borders and how this certificate is used within national borders is completely a national decision. And each member state has the autonomy to decide what to do with this certificate within their territory. But this was not communicated, I think, in the best way. And the perception with many people was that actually EU is preventing you from accessing freely public services, hospitals, restaurants, or whatever. And because of this kind of perception in many member states, it will be very hard to maintain the use of these certificates also after in the years to come for other purposes. I have to say, as was pointed out before, yes, policymakers, unfortunately, or fortunately, whatever you want to call it, have to deal with public perception and the public atmosphere and public in general. And I think that the idea to use these certificates or this infrastructure to in the future to impose some new restrictions, for instance, in case of some future pandemic or some future public health threat, is something that not a lot of politicians will be brave enough to do, I have to say.
Thank you. I'm conscious of time, but everybody is staying, so I'm going to go with a couple more quick questions, if that's okay with the panel. So Tudor, first of all, in terms of, can you give us an idea about when you're going to be publishing the sort of phase 3, phase 4 summary information for the audience?
Vladin, I expect that for phase 3, maybe this summer, and for phase 4 toward the end of this year, because it's quite a challenge, this area of Asia Pacific to be covered. So we expect, as I said, toward around I don't know, maybe July, August, to have the report for the third phase. That is possible to be extended to other geographies. We will see. And as I said, the other one toward the end of this year, I hope.
Yeah, great. Thank you. There's a very interesting comment from Roberta at WHO saying, this is a comment on the WHO position. Requirements for vaccination with regard to travelers is regulated through IHR and is limited to yellow fever for selected countries, polio in cases of outbreaks, and meningitis for Haji travelers. There is no other use for vaccination certificates to limit or regulate travels. Tudor, another question for you. Did your analysis provide evidence supporting the effectiveness of immunization coverage or registry systems during COVID-19? Did countries with a better coverage or better registries have a lower rate of infection or mortality? Did you pick up any of that?
Well, of course, I was looking toward that. It was not part of our focus, but of course, I was interested to see. Well, I haven't. I was not able to pick up this kind of correlation very clearly. There are so many variables involved. and they were, as Tomislav said earlier, you know, in the health area, each country decide what to do. So there a very wide area of reactions. There'll be a wide area of reactions regarding on how to use the existing system. We have countries in the northern area that was able to use the existing systems, you know, for COVID vaccination. But when you enter in the analysis, a political decision with economic roots and other variables, that you would not close, you know, I don't know, the public places, or you would not confine people in homes. You know, in this case, the electronic vaccination registry or the system that they have in place cannot do much difference. You know, there is this variable, this political decision with economic roots that that has a major impact in this area. What is important regarding the systems and the COVID experience is that, as I said, some countries used this challenge to improve their existing systems, but a lot of others decided to build new systems, and some of them now are migrating their old system toward the new one. So they are using for other vaccines, they are using the framework built from scratch for COVID. So there are different approaches. I cannot say that there was an impact, direct impact regarding the mortality, but definitely in the future, this would be the case. Yeah.
Thank you.
Due to this technical improvement that has been made.
Thank you, Tudor. And I'd like to bring the webinar to a close now with some quick concluding remarks. So I'd like to thank all of the panelists. I suspect that we could have carried on for another half an hour or perhaps an hour with the questions. It's very clear to me that some of the remarks about the controversy of this topic are very true and very pertinent. But at the same time, the importance of vaccine and vaccination rates and vaccine information systems could not have been more apparent either. And I'd like to conclude with a statement that I think that between the work that Deepak and I have been doing on the round table, between Tudor's work, which is still ongoing, and then the EMA work, we have a determination to keep working together to try and drive forward the improvements that are needed in the interests of citizens and patients as a whole, as well as the contribution it can make to the establishment and success of the European health data space. Because I think we all believe, notwithstanding some of the issues around the European health data space, it's fundamentally important for Europe that the EHDS is a big success. So with that, thank you all. And I look forward to as many of you joining the email event on the 26th for the next discussion. So thank you all and enjoy the rest of your day.
Thank you.
Thank you.
Thank you.
Thank you. Bye-bye.